Linsey Heidelberg, a three-time All-American cheerleader, suffered a fractured vertebra when a teammate fell on top of her during a stunt. She had no sensation in her left foot and was in severe pain.
We were introduced to a pain management doctor who put Linsey on Neurontin 300 milligrams 3 times a day, so she was taking 900 milligrams, along with, at that time she was taking Tylenol 3, and we eventually had to switch that to hydrocodone with ibuprofen, 200 milligrams 3 times a day. And he scheduled her for nerve blocks, sympathetic nerve blocks in her back. She had 5 of those total. Nothing touched the pain.
Linsey experienced seizures as a result of the pain and was scheduled to have a spinal cord stimulator implanted, an expensive, invasive procedure. Dr. Andrew Park, Linsey's orthopedic spine surgeon, explains why he referred her for InterX treatment.
Here's a really young lady. She's not even out of high school. We've tried all of the conventional medical treatments, and the next step up using the normal decision-making pathway leads to something fairly invasive. And I just thought to myself, if this is my daughter, I don't think I would like her to get a spinal cord stimulator, so I'd like to try something non-invasive and see if there's alternative methods of getting her better.
After, I think, the 9th treatment, I actually started crutch walking because it brought down the pain to a level where I could handle it, so I was like, okay, I'm going to crutch walk today. After 14 treatments, my pain's gone down to 4. I feel everything in my foot. I don't have my crutches anymore. I walk with a knee brace. I feel like my old self again. I'm able to hang out with my friends. I'm able to go to the movies. I'm able to drive. I have my life back.
Given the fact that she wasn't weight-bearing, she was using crutches and not in school, she wasn't doing any activities, and then compare that to what I've seen after a number of treatments. She's walking. She celebrated her birthday with all of her friends, and she was able to do some dancing type of activities. I mean, it's amazing. She's really made a dramatic improvement.
In the first year after being treated with the InterX, my mom was treating me once a week, and then it ended up being 2 weeks, and now I only get treated maybe once every month because I don't need it as much. I have no pain in my knee at all anymore. It's completely gone, and when I was first being treated, after everything, it was like a 2 or a 3. It was like a constant 2 or 3, and it's just completely gone now. I don't feel it at all. My knee gave out every now and then, and I was in braces every now and then, but it wasn't like I hadn't had a seizure since I've been treated by the InterX. I haven't had a seizure, and I still haven't even felt like it any time. I could basically have been a pharmacist. I had so much medication that, my mom still has all that medicine just in case in a cabinet, and in the laundry room, and there's 8 different shelves, and for that year and a half that I had RSD, it takes up a whole shelf of medication, and that I haven't touched since I've been treated with the InterX, but it's just still there just in case I need it, but it's a whole shelf. So there was a lot of medication. And then I had the steroid injections, which didn't help, but that was a lot too, and yeah. I don't have any restrictions, but I really haven't had time to actually do any functions, but whenever I do have time, I have no restrictions to anything. I was going to go skiing this Christmas, so it feels amazing because all that was taken away from me. Not I didn't have a choice for that to end in my life, and then I can still do it. It means I still have control that I can do it, and I can show people, hey, I was hurt, but I can still do a little bit. So it's awesome.